Hi, Ale. Can you
Hi,
listen to me?
Miss. How are you?
Listen to you.
Can you hear me? I can't hear you, Miss.
I can hear you now by my headphones. But can you listen to me well?
A little. I don't know. There is much sounds.
Not so much.
No.
I'm so sorry. I will try to fix it. Ale, Ale. I can hear you, but you can hear the sound?
Yes, a
Yeah?
little. A little,
Okay.
but yes.
I'm so sorry. I just don't know why it's happening. Okay, I can hear you. So I will make you some questions, okay?
Yes, Miss.
Describe. Did you have the chance to watch the class of last week?
I couldn't find the video on YouTube.
Vale. But
I
I
would be
know you
grateful
know how.
if you could send me the link or I don't know, or tell me the topics.
Okay, but you know that you can find the things on YouTube, right? I told you last class that too. All the topics we were having, all the classes, all the records are on YouTube. Okay, I
Mm,
wanna know if you make some time a prescription for medication. Did you have the chance?
mm, sorry, Mrs. I can't hear you. Um,
I want to know if you had the chance to make a prescription sometime. If you write down a recipe for a patient, do you know how to do it?
yes, but I didn't practice too much. Do you want I send you the prescription later? Maybe. Mm, I can't hear nothing, teacher.
Okay, just let me adjust this, okay? Wait, please, Ale. Ale, can you listen to me now?
Mm, a little.
We are in the same page.
It's the same.
I cannot even listen to you. Let me adjust this.
Mm, I can hear you, Miss.
Okay, Ale, I'm gonna go now and I'm gonna enter again. Okay? Just wait, please.
Okay. Mm. Hi, Miss. Can you hear me? I can't hear you, Miss. It's worse.
Ale?
Yes, Miss.
Ah, I can hear you now. I'm so sorry about that. I was trying to fix this. Okay, I was telling you that if you have a chance to write down a prescription sometime.
Like now, or
No,
maybe,
before, while you were studying.
and I could send you the prescription.
No. I
Maybe.
want you to tell me if you have a chance and what kind of things you put on that prescription when you write down
Um,
for your patient. What is important?
uh, the maybe the treatment. First, the date, the name of the patient,
Okay.
the the treatment, the doses.
Yeah.
It's okay.
It's okay.
Um, and the amount of the treatment.
Yeah, that's good. Um, milligram, right?
Sorry.
Or milligram, right?
Um, yes.
Or you
Maybe.
said 2 pills, but you have to put the dosage, as you said, on milligrams, right?
Maybe yes, but we have to put the amount of pills if we have to prescribe pills.
Okay.
And in that case,
Yeah, that's good. Okay,
or
perfect. Oh, continue.
no, that's all.
Okay, that was good. And what kind of drug you were prescribing or you saw that, that were the most common ones?
Mm, what treatment is most common? Sorry, I.
Yes. Yeah, what kind of treatment do you recommend always is the most common that you saw on your consultation or while
mm,
you were studying?
the I don't know, maybe the style of the life, like they have to eat well and make exercise, and sometimes we have to give some It's like ibuprofen or something like that.
Okay. Okay. I thought that you were prescribing ibuprofen, maybe paracetamol or acetaminophen, right? Those
Yes.
are the most common ones, right?
Mm-hmm. Yes, they
Okay.
are
Okay.
common in
I
concept for
want.
inflammation.
I'm sorry. I'm sorry. Tell me. Tell me.
No, continue, please.
Okay. Can you talk about two contrasting therapies you have experienced? What are the advantages and disadvantages of each one?
Sorry, Miss, I couldn't hear the last part.
Okay. I want you to talk about two contrasting therapies you have experienced. And I want to know the advantages and disadvantages of each one
Um,
for
uh,
any disease.
well, it could get low the inflammation is that it's, it works for that. But the disadvantages it could make the patients they can make blood cicatrizar.
Make the patient what, sorry?
Um, Cicatrizar o las heridas, digamos. O sea, tienden más,
Uh,
eh, pueden hacer más
they
hemorragia.
have they have hemorrhage,
Yes,
right? Okay. If they use ibuprofen,
yes, or paracetamol.
oh, I didn't know that. Oh, if they use continuously, or what is the situation?
Yes, if they use continuously.
Okay, I didn't know that. I thought they can cause gastritis, maybe,
Yes,
and
it's fine. It's okay.
some liver
Good,
problems, or no?
yes, it could make the patients have gastritis.
Okay, what other consequences have ibuprofen? Or maybe you can talk about amoxicillin, maybe.
Could produce the capacity of hear disappears when used for too long or for much time.
Okay. What else? Is there a contraindication for that?
Sorry?
Is there a contraindication for that?
Yes, if you use too much, it could produce, it could make the people reduce the capacity of hear.
Of here?
Maybe,
Oh my gosh,
maybe
I didn't know that.
or maybe I'm
Okay.
wrong. I don't know.
Okay. Okay, Alex, I will send to you a photograph of the questionnaire, okay? And I will ask you please to rewrite a circle and the answer you wanna send, okay? And please, can you send to Allison that answer for this class?
A questionnaire?
Yeah. I will send a photograph of the questionnaire and I will ask you to write on the answer you wanna choose. And then after that, send to Alisa. Can you do it for me?
Yes.
Okay. Thank you, Ale. I will send to you after class. Okay?
Okay, Miss. Thanks.
Okay. Thank you very much. Take care. Bye, Ale.
Bye, Miss.
Thank you. Bye bye. Hey, Lily.
Hi, teacher.
How are you, Lily? How is everything? You're at work.
Eh, Yes, in the moment I am working.
Okay, I can see that. And how was your day? It was so busy?
My day was very good. I read all day. I start to work at 5 p.m.
Okay. So you were resting before that.
Repeat, please.
You were resting before that, doing things at your home,
Yes.
right?
Uh, right. Whole day I rested.
Okay, that's good because you have a long shift today, right?
Right, teacher.
Until tomorrow at 7.
Yes, my shift during 5 p.m. until 7 a.m.
Okay. I'm sorry. I was just listening behind me at the pianist. Can you see him?
No problem, teacher.
Okay. Can you describe a prescription for medication you often have prescribed in your own language? Can you describe me?
Hmm. Repeat, I don't listen. Uh, I
Okay.
don't listen.
I want you to describe for me a prescription for medication you often have described in your consultation.
Your prescriptions. When I prescription the drug to my patients, I uh, I will indicate um, how to take in the drugs, the during of treatment, if they should drink with meals or not, the dose.
Okay, that's good. I want you to continue, please. I'm just moving. Okay. Okay, Lily. Now,
Okay, teacher, tell me.
I'm so sorry. Can you talk about two contrasting therapies you have experienced and advantages and disadvantages of these therapies that you have experienced in your consultation?
Advantage and disadvantage.
Advantages of the therapy that you have used or you usually use.
Usually just it's depending the type of therapy. For example, when using drugs, there are adverse effects. I explain the patient. For example, if I prescribing metformin for patients with diabetes, I said this drug can prove swelling abdominal or flatulencias, no sé qué más. Therefore, they have drink with with full stomach, no sé, with milk.
Okay. Is there any chance for that treatment to cause allergy?
Allergies. First, I asked if the patients have any type of allergies. For example, when I prescribing dipirona, I know this drug it's common to generate allergy. For example, rats, dyspnea, dyspnea. What's dyspnea?
Yes, dyspnea. It's
Dyspnea.
just when you
Dyspnea,
say
edema,
generate. Just a correction. When you say generate, it can be probably generate or it can be probably cause allergy. When you say that something will make or will cause something on that person, okay? In your experience, Lily, can you recommend any kind of therapy for any kind of disease you want? And can you describe for me maybe some symptoms, a diagnosis, and then a therapy you usually use for that disease?
Teacher, I don't listen. I believe my internet is unstable or not because I don't listen. In the moment, I am with my mobile date. I don't listen. Repeat, please.
Yes, of course. In your experience, can you recommend any kind of therapy for any disease you want? And maybe you can describe the disease, the signs and symptoms, the diagnosis, and then the treatment for that disease. Any disease you want.
Mm, es que no entendí lo que me preguntas, que haga una recomendación, no sé, ¿qué les recomiendo a mis pacientes? No, I don't,
Yes.
no sé si es que no escucho o no
Okay.
entiendo.
Okay. I will start again. Okay. Choose any disease you want. Then describe for me the signs and symptoms. Make a diagnosis about that, and then tell me the therapy for that disease. Can you do it, please?
Please, teacher, tell me in Spanish. I don't understand. Please tell me in Spanish.
Ok. Quiero que escojas una enfermedad con signos y síntomas y des un diagnóstico para luego darme el tratamiento de esta enfermedad. Ahora sí.
Que escoja una enfermedad, que dé los síntomas y luego el tratamiento. Yo creo que es el problema de mi internet, que no...
Yeah, I know. Don't worry.
Talking about the hypothyroidism. The hypothyroidism, it's a illness which presenting the most frequency with the women, the age between 20 to 50 years old. The symptoms means are overweight, malaise, loose hair, dry skin. The people are very tired. Your diagnosis it's with my think the levels or T3 or T4 and TSH. If the TSH is high, in presence the T3 or T4, the T3 of T4, it's low, then we performed the diagnosis. Your treatment is with supplement hormone with levothyroxine.
Okay, Lily, thank you very much. Lily, I will send my questionnaire by a photograph, okay? And
Okay.
you will rewrite the answer you choose, and then you will send to Alison, please. But I will make it at the end of the class, okay?
Okay, teacher, no problem.
Okay, Lily. Thank you very much. Take care.
Thanks. Have a good night. Bye bye.
See you tomorrow. Hi, Belen.
Hi, Miss. Where are you?
I'm at the coffee station.
Oh, okay.
I don't know if you can listen the sound behind me. So?
Well, a
Okay.
little bit.
Okay, that's good because I'm wearing my headphones. First, when I was talking to Ale, it happens that those doesn't work. So I had that problem. it was some such a trouble with her. Okay, how is everything? How is your boyfriend?
He's better, but I'm in Cochabamba now. I came back. So yes, but he has to stay for a month so he can travel because pressure of his nose, he can
Yeah,
handle it with the plane.
so that's so bad. But the good answer, the good news is that he's okay. He will be better with his new. I don't know how oh why did he get an operation? Because he
He has
didn't.
no, it's not aesthetic. It's not. He
Ah,
has hypertrophia of the cornetes. I don't know how to say it in English. Has lipomas too,
yeah.
and also he has a septumplasty. Septumplasty. I don't know how to say it. Tabique desviado.
Yeah. I have some information about the lipo. What did you say?
Lipomas.
Lipoma. Yeah, I thought it was that. Uh, they some friends told me that they have reappeared in some time. I don't know if the doctor tells you that.
Yes, when you are exposed to the risk factors, yes, it can be. We can we can have it again. So that's the hair of the pets. The also we can have the animals, the dust. When we smoke too, that are the things that they are a risk.
Yeah, of course. So he can smoke anymore.
No,
Okay.
he loves.
Oh, but that's a good reason. That's good, I think. Okay, Belen. Let's get into our thing. Um, can you describe a prescription for medication you often have prescribed in your own language?
Miss, I can hear you very well. Maybe you can write in the chat so I can answer.
I'm so sorry. I'm here, and I thought it would be better, but somehow a man started to play the piano. I will write down, okay?
Okay. Okay. First, we have to put the name of the patient in the superior part. Then we have to describe the meds that we're gonna make the prescription, like, I don't know, like losartan. And then we have to put the down that we have to put, no, in the side of the med of the prescription, we have to put how many pills we are receiving. Then down the med, we have to explain how she is going to take the med, like 2.1 pill in the morning and 1 pill in the night. And after that, specifying the how she's gonna or he's gonna take the med, we have to sign, and that's how I can prescribe in my own language.
Okay, that's good. I wanna make you another question. I will write it, okay?
Okay, about contrasting therapies, means do you refer to the MRI and that things on the ultrasound?
No, maybe two therapies that you use for one specific disease. And how would you manage that?
For I don't know if I hear it well. It's for specific things, the contrasting. Yeah, I know that we use the construct. Okay.
Hi, Belen. Oh,
Yes.
can you listen better to me?
Yes, a little bit better. I hear just
Ah,
voice.
okay, I'm so sorry about that.
No, it's okay.
Okay, I don't know if you can, you use sometimes kind of therapy for one disease.
Therapies for specific disease. Please, I don't know what you are trying to say, like therapies or contrasting therapies. I don't know. What do you refer?
Yeah. That's good. Contrasting therapy.
It's I don't know. We want to see the urethra. We can use a contrasting therapy, injecting a fluid, or maybe sometimes we use to give the patient a liquid, so we can, when we see the exams, it makes it's like fluorescent. So we can use for see if we have an obstruction, if we have tumors, and that things. I don't know if you refer that.
Yeah, that's okay. That's good. I was talking about that. I I will send to you another question. Okay?
Okay.
Okay.
Okay, endoscopy surgery. How important? And well, I think that we mentioned this another speaking class. I remember some kind of things that
Yes, we speak about the differences between an endoscopy and another one. Do you
yes,
remember?
yes, enteroscopy.
Yes, but
Yes.
now that is popular as we know. What are the advantages and disadvantages of the surgery?
Okay, about the surgery, it's less invasive because with endoscopy, we can see a lot of structures that we used to see when we open the patient. So first of all, we're not going to make a wound. So we know the patient is not going to have the stitches and that things that we uh, that I think that it takes so long to the recovery of the patient because the patient has to go to make him the, I don't know how to say curaciones. How can I say it, please?
When you talk about therapy,
What, miss?
when you talk about therapy,
No, 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 the curaciones, the meaning in English.
okay, let me take, I almost forget about that, even me. Okay, we're gonna talk about the healing process.
Okay, the healing process. Okay. Then we also have the, I'm getting desconcentrada. The infections maybe we can reduce with the endoscopy because of the wounds that they are more probably to get an infection. Then we talked that it's not invasive and that I think that were the advantages.
Yeah, yeah.
But then how can I say disadvantages?
Dis disadvantages.
Disadvantages that maybe I don't know, that we cut a little bit more in the endoscopy and we don't have a control of the bleeding. So it's more difficult to to save the patient. I don't know. Depends how deep is it or what do you cut.
Okay. Yeah, but that's you. That's a good answer. Okay, Belen, thank you very much. And I'm so sorry about that. I couldn't listen well, and you couldn't listen well. But I will send to you a photograph of the question, okay? And I will ask you the same as the other guy. Please, you will write a circle on your answer and then send to Alice, please.
Same to you, Miss
To Alison.
Alison. Okay.
Yes.
Okay. Okay, Miss.
Okay. Thank you so much.
No, you, Miss. Have a great time. Bye.
You too.